Dr. Rodrigues works as this is another fun one, biostatistician. People often expect her to focus only on the numbers, but her real passion is what is behind the numbers, the stories. In studying mental health and addiction, she realized that opioid use disorder isn't just about overdose deaths. Many people live with its long-term deficits and effects. Her work uses statistical methods to uncover the trajectory of illness and to find ways to improve their quality of life. Without further ado, Dr. Myanca Rodrigues.
I will be talking to you about how we have to move beyond overdose in the opioid crisis. Every day, 21 Canadians die from opioid overdoses. But what about the 350,000 who survive and live with opioid use disorder? Meet one of them. Alex struggles with depression, complicating his treatment. As he comes off opioids, the issues that led to his use remain unaddressed. What's worse, he has heart disease. People with opioid use disorder are at a higher risk of heart disease and heart attacks compared to the general population, particularly as they're recovering from opioid use. And Alex isn't alone. Opioid dependence affects the entire body, with many people often experiencing 2 or more chronic diseases, known as multimorbidity. Yet, the overdose problem is almost synonymous with opioid crisis, and few studies examine the long-term health impacts. Which brings me to the bigger issue. Despite Canada being at the center of a worsening opioid crisis, we do not have a lot of research looking at the long-term health impacts of this disorder. Without this data, we lack the knowledge to design care that works. And this isn't just a medical problem, it's a health system failure. Multimorbidity leads to greater complications, higher costs, and places the entire health system under strain. So how do we fix this? That's where my research comes in. To address this gap, I used Ontario as a case study, a province with both rural and urban treatment sites, diverse socioeconomic conditions, and a representative sample of the crisis. I analyzed data from over 3,400 people receiving treatment across 57 addiction centers between 2011 and 2021, linking their clinical records to provincial health data and following each person's health data for 8 years. First, I identified 16 chronic diseases that are commonly included in multimorbidity research. Next, I assessed their prevalence over an 8-year follow-up with the bubble size corresponding to how common each disease was. Then, among those who had at least 2 chronic conditions, I applied hierarchical cluster analysis to identify disease clusters based on how often conditions co-occurred. So what did I find? 1,114 people in the sample had multimorbidity. That means 1 in 3 people with opioid dependence has at least 2 other chronic diseases. And among this subset, 6 distinct disease clusters emerged, the most pertinent of which I will discuss today is the largest cluster, comprising cardiovascular, cardiometabolic, and respiratory diseases. Now, this affected over 660 people and requires very careful consideration. For example, if a patient with opioid dependence additionally has COPD and congestive heart failure, well, this poses some severe risks. The ACE inhibitors for heart failure can interact with opioids, causing dangerously low blood pressure and breathing issues. Opioids further suppress breathing, which complicates COPD management. Now imagine this patient navigating a health system where specialists don't coordinate care. The risks are enormous. That's why we need a multidisciplinary approach, where primary care, cardiology, and addiction specialists work together to provide safer, more effective treatment. Canada, one of the countries hardest hit by the opioid crisis, still lacks critical data on its long-term health impacts. Without it, people like Alex continue to fall through the cracks. My work lays the foundation for a new model of care, one that doesn't just treat opioid use disorder, but recognizes and addresses the full scope of health challenges that people face. Because the goal isn't just to respond to crises, it's to move beyond overdose. A huge thank you to my study participants, supervisors, the McCall MacBain program, and thank you for listening to me.